Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Victoria Leiphart. She is board certified in obstetrics and gynecology.
This talk, I'm not surprised, it's pretty well attended, as all of us as, middle-aged adults fear dementia. If you ask most people what they fear as they age, it is not becoming frail. They're not afraid of dying. They are afraid of losing their mental capacity. So I'm going to talk about some of the risk factors for dementia and what you can do to impact your own risk factors. There are a number of things that we know have an adverse impact on brain health. If you eat a poor diet, if you smoke, if you use alcohol to excess, if you have existing heart disease, diabetes, or other major health problems, all of those things increase your risk for dementia. Insufficient sleep, particularly if it's chronic, is a risk factor for dementia. Being sedentary is a risk factor, and being socially isolated is a risk factor. And I'm going to talk about those in more detail. But this is a huge problem nationwide, particularly as we're living to be older and older. Half of 85-year-olds, have dementia, a fourth of 75-year-olds, and an eighth of 65-year-olds. And, sort of the take-home message from this talk is going to be, if it's good for your heart, it's good for your brain. Nutrition. We know that nutrition impacts just not only your risk for heart disease and diabetes, it also impacts your risk for dementia. A Mediterranean diet, which includes a lot of fruits and vegetables, whole grains, beans and other legumes, nuts, seeds, olive oil, a little bit of seafood and poultry and eggs and dairy, and very little red meat and sweets. This diet has been shown to improve memory and problem solving. And there have been a number of studies to try to tease out what it is about the diet. It's probably the global diet. But they looked at a group of Spanish adults who were already eating this as their baseline diet, and they added more nuts to the diet of one group and more olive oil to the diet of the other. The group that got more nuts had improved memory, and the group that got a little more olive oil had improved thinking, reasoning skills. And it's clear that hydrogenated oils, that's, margarine, if it's got the word hydrogenated in it, you should avoid it. Read the labels. Hydrogenated oils are often used in crackers, cookies, cereal, because those oils are more stable, they're less likely to become rancid, and so you extend the shelf life of those products. Coffee and tea are good. They have antioxidant effects. Caffeine improves your alertness. It improves your ability short-term to perform tasks. Tea, particularly green tea, has an antioxidant effect, which is good for your brain. Coffee and tea, coffee has been shown to reduce your risk of developing diabetes, and diabetes, as I'll talk later, is a significant risk factor for dementia. If you have low omega-3s, we all think of salmon and fish oil for omega-3, but in fact nuts and chia and flax are also good sources. If you have low omega-3 intake, you're at higher risk for depression and maybe at higher risk for dementia. If you're thin, if you calorie restrict, you have a lower risk of Alzheimer's. In mice, that's what this picture is. You have preservation of more gray matter in the mice who are on calorie-restricted diets, and less gray matter and more atrophy of the brain in the mice who were fed more calorically generous diet. Turmeric, we know, reduces your risk of cancer, particularly colon cancer. It may reduce the risk of Alzheimer's as well. It's thought to have an anti-inflammatory effect. There's no data, none whatsoever, on turmeric supplements, none whatsoever. The data on turmeric all comes from population-based studies where you look at populations that consume turmeric as a regular part of their diet. So it is not 100% certain that it is the turmeric that is the key ingredient, but it is thought to be a critical ingredient. In India, where turmeric is widely used, they have an extremely low rate of colon cancer, and part of that is thought to be due to the largely vegetarian diet, and part of it is thought to be due to the turmeric consumption. Smoking, alcohol, marijuana. Smoking over the short term actually improves your attention, and you have better memory and attention span immediately after smoking. But over the long term, you get loss of brain matter. You get thinning of the cerebral cortex, that gray matter that's responsible for your higher function. And long-term smokers have worse memories, worse problem skills, and a higher risk of developing dementia. Alcohol, we all know that short term it makes you stupid. If you're consuming alcohol, that, you do stupid things you might, not otherwise do. But long-term use, especially heavy use, binge use, also causes shrinkage of the brain. And it's a problem in this country because about 6% of the population is a heavy user. The people that you think of as abusive drinkers, alcoholic drinkers, and about 23% of the population binge drinks. And that's usually defined as 4 or 5 drinks in one evening. And that also causes shrinkage of the brain. This is an alcoholic, and this is somebody with a normal brain. So you see how much brain tissue this chronic alcoholic has lost as just a result of alcohol abuse. Marijuana. Heavy marijuana use impairs the development of neural connectivity. We all, as we're growing and maturing, particularly in our teens and early 20s, we are all still developing those brain connections. Your brain, one part of the brain speaks to another part of the brain. And if you are a heavy marijuana user as a teen, you get fewer of those fibers and less connectivity. And people who have good connectivity of the different parts of their brain are less likely to become demented. And unfortunately, the parts of the brain that aren't connected are the parts of the brain that, such as the precuneus, which is responsible for alertness, self-consciousness, awareness, and the hippocampus, which is your learning and memory part of your brain. And so you get less connectivity, which means that for the rest of your life, your ability to form new memories, to be alert, to have good, higher executive function thinking is impaired for the rest of your life. If you are a heavy marijuana user in your teens and early 20s, you have full brain development by 25. So I know a marijuana researcher who says smoke all the marijuana you want after you're 25, but not before then. Let your brain fully develop, and then if you want to smoke marijuana at that point, feel free, because your brain is already developed. But in the teens, when there's so much brain development still happening, heavy marijuana use significantly impacts that, and it's permanent. Heart disease and diabetes. Like I said, if something that you do is good for your heart, it is also good for your brain, because a lot of what happens in the brain, a lot of dementia is vascular dementia. So if you have poor blood flow to your heart, then you also have poor blood flow to your brain. And if you look at people who already have heart disease, they do much worse than on cognitive tests than people who do not. In fact, even people who don't have heart disease but have risk factors for heart disease, the people who have the most risk factors for heart disease will do about 50% worse than the people who have the fewest risk factors. And the typical risk factors are elevated blood pressure, diabetes, obesity, and increased waist circumference. Those are sort of the usual. Oh, and high cholesterol. Those are the sort of the usual risk factors. So if you have bad scores on all of those things, you're going to do worse on memory and thinking tests than if you have good scores on those things, even if you have never been diagnosed with heart disease. So the greater your risk factors, the worse you do on cognitive scoring. Women who have existing heart disease have a much higher risk of developing what we call mild cognitive impairment. That is a precursor to dementia. It means that you don't have full-blown dementia, but you are starting to have some memory issues, some cognitive slowing. If you have a heart attack, if you have heart failure, your brain can suffer as well. You can have a decline in your brain function if you have those things as well. There are a lot of researchers who feel that Alzheimer's disease should be called type 3 diabetes, because the association with diabetes and with behaviors that increase your risk of diabetes, such as high sugar consumption, that all of those things impair your long-term thinking and memory abilities. And that if you stay away from added sugars, if you stay away from simple carbohydrates like white bread, pasta, white rice, you don't get that rapid spike in insulin and all of the other metabolic disarray that comes with being diabetic or pre-diabetic. And we know that the part of the way that diabetes harms your organs is by the high blood sugar causes damage to the tissues by glycosylation. You get added like little extra sugars tagged on to things that cause damage. Diabetes is the most common cause of kidney disease that leads to dialysis. It is the most common cause of blindness. It is the most common cause of foot amputation in this country. And that is all because of that blood sugar damage, and that same stuff is going on in your brain. For every 10 years that somebody has had type 2 diabetes, their brain looks on imaging as if it was 2 years older than their biological age. And for long-term diabetes, there's some studies that suggest the risk of dementia may be doubled by being diabetic. So if you're diabetic, being under good control negates very much of this risk. If you're borderline diabetic, exercise, diet, keeping your blood sugar in the normal range, staying out of the diabetic range, all of that dramatically reduces your risk not only of heart disease and stroke, which we know are associated with diabetes, but also your risk of dementia. Here is my plug for sleep. And again, my plug to come and hear Dr. F. Timmy talk. When you are sleeping, your brain is solving problems. We've all had that experience of going to sleep, thinking about a problem, being unable to solve it. We wake up the next morning, our brain was working on it all night. The next morning we have that eureka moment and we say, I've got it. I have figured this out, because your brain is doing that work overnight. Your brain is also consolidating memories. So if you are learning something, you will actually know it better the next day than you did the night before. And this is why for teenagers and college students pulling all-nighters, they are doing themselves harm. I wish I knew this data when I was in college. And because I was the classic all-nighter. I used to stay up all night and study and go for the exams. But in fact, if you study, then get a good night of sleep, you remember much more the next day, because your brain is consolidating and firming up those memories as you sleep. And your brain also needs that rest mode. It needs time to daydream. We oftentimes will actually do a task better if we're a little distracted, because then our brain gets that sort of daydreaming process going, and we'll be a little more creative if we're distracting our brain with something else. Now, that's not true for a really demanding task that needs all your attention, but it is true for certain kinds of problem solving. We all should be sleeping 7 to 8 hours a night, and the average amount of sleep for an American adult is more like 6, 6.5, 7 if they're lucky. Sleeping 6 hours a night for 2 weeks affects your cognitive function and makes you as stupid as if you had had 2 nights with no sleep at all. You are chronically sleep deprived, and the problem is you're running chronically sleep deprived at a lower level of cognitive function and not even aware that you are functioning at a lower level. When I was going through residency training, we were all living on, 4 or 5 hours of sleep a night, and it was like this macho thing to brag about how little sleep we had. And, I was in there with them. My attitude was, I'll sleep when I'm dead. And it was not until I started getting regular sleep that I realized how kind of chronically tired and foggy I was at that stage of my life. We all know that vacation is great. We all come home feeling rested. We feel wonderful, all of that. That rest, that better brain function, all of that, it's gone in a week. It's gone in a week. So what we really should be doing is taking more 3-day weekends and less, time off, because then we get that rest, and we need time at home that we are not working. So many of us, and I'm guilty of this, bring work home and are working at home. You need sanctuary time that you're not working and that you have time off. There's also benefits to brief breaks. If you get up, take a walk, take a 10-minute nap at your desk, you're going to function better. None of us can really stay focused and concentrate for more than about 4 hours. At that point, you just have to take a break. If you're trying to power through and function for 6 hours, 8 hours without a break, your cognitive ability just really declines. And even getting up and taking a, brief 10-15 minute walk or taking a 10-minute power nap will work. And a 10-minute power nap is just as effective as a 30-minute nap, except with a 10-minute nap, you don't feel as spacey and sort of hungover a little bit afterwards. You wake up and you're alert. Being out in nature improves your memory, and it improves your performance. There have been studies on college students where they had them learn a series of words, then they had them go to a different part of the campus. One group, they routed through an area that had trees and greenery, and one group just got routed through a bunch of buildings. They were both outdoors, same distance. The kids that walked the 10 minutes and saw trees versus 10 minutes and saw buildings did much better as far as word recall. And if you look at long-term meditators, people who have on average been meditating about 30 years, if you look at 50-year-old meditators, their brain function is better than healthy 20-year-olds. And it's even better after they've done like a 3-month meditation retreat where they've been doing nothing but meditating for 3 months. But the good news is for the rest of us mere mortals is that you get significant improvement in your memory and cognitive function if you meditate for 5 to 10 days in a row of meditation will change your memory, and 10 minutes a day has been shown to have a significant impact. There is the most common meditation program, the secular meditation program taught in this country is mindfulness-based stress reduction. There's data out of Boston that, I think out of Harvard, that 8 weeks of daily meditation, half an hour of meditation for novice meditators, structurally changes the brain. You get shrinkage of the amygdala, that fight or flight stress, emotional part of your brain, and you get thickening of the hippocampus, that memory part of your brain. So I've taken that 8-week class, I'm just saying. anything that is going to change my middle-aged brain for the better, I am good with that. Acute stress, we all know when we're under stress, we don't have good judgment. Chronic stress actually shrinks the hippocampus, the memory part of your brain, and enlarges the amygdala, that fight or flight stress part of your brain. So the reverse is also true. Being chronically under tremendous stress has the opposite effect on the brain. Exercise. Forget all the brain training games, forget all of that. If you take one message home from this talk, this is the best thing you can do to stave off dementia. The data on prevention of dementia, slowing of dementia, all of that is better for exercise than for anything else. No drug, no brain fitness app comes even close. Some of that is a direct effect. It's that reduction in inflammation, reduction in insulin resistance, stimulation of growth factors for your brain, for your blood vessels. And some of it is indirect. Your mood is better, your sleep is better, you have less stress, you have less anxiety. For sedentary adults over the age of 55, you get a 1 to 2% decrease in hippocampal volume a year. That's the memory part of your brain. If you participate in regular aerobic exercise, they did studies, they did MRIs before and after a 1-year period of exercise, the people who engaged in regular aerobic exercise, and in this case, it was walking for half an hour, I think 5 days a week, they had a 2% increase in their hippocampal volume. So you can completely stave off that age-related decline by just going out and taking a walk every day. And if you can walk someplace where you see trees and greenery and plants, you get a significantly greater drop in blood pressure, stress hormones, heart rate. So, you know, the treadmill, it's acceptable, but walking outdoors is better. You have to find something that you enjoy. And I encourage my patients to do something that is social. If you exercise with friends or family, you're much more likely to keep exercising. And if your exercise meets your social needs, then you're doing one other thing to stave off dementia. And if you exercise outdoors, then you get the benefits of being out in nature. The Japanese call it forest bathing, and they do it as treatment for stress, for anxiety, for depression. Immediately after exercising, after say a 30-minute walk, you get about a 15% improvement in blood flow, and that boost in blood flow to your brain, to your heart, lasts for 72 hours before it's completely back to baseline. So it's not just an immediate effect. You have improvement for actually more than a day. Social interaction, another reason to, hike with your girlfriends. Loneliness increases the risk for early death by about 45%. For people who describe themselves as lonely, they are at greater risk of developing dementia. In one Dutch study, that risk was a 65% higher risk. It's hard to tease out whether loneliness contributes to dementia or whether if you know that your cognitive functions are slipping, you feel embarrassed, you feel uncomfortable, and you start avoiding your friends and family. So we don't know for certain that loneliness causes dementia. We suspect that it contributes. It may be that dementia causes loneliness, but it's probably the reverse, that being socially isolated contributes to not only unhappiness and a higher risk of death, but probably a higher risk of dementia as well. Interestingly, volunteering has the same imaging effect on the brain, on MRI, as exercise. So if you volunteer, you're getting social interaction, you're making the world a better place, and your brain gets that same enlargement of hippocampal volume as if you went out and took a walk every day. So I encourage all of my retired patients to do some kind of unpaid work because it is good for the community, it is good for their social interaction. Your personal happiness is substantially increased if you're a volunteer, and it is good for your brain. Medications. Sometimes a person will appear demented, and what they really have is actually a medication side effect. This is more likely to happen in somebody who has less reserve anyway, who already has a little bit of mild cognitive impairment. You give them certain drugs and they can just look full-on demented. And some antihistamines, some of the anti-anxiety drugs, sleep aids especially, that's a big one, some of the muscle relaxants. There's a whole class of all these drugs that can kind of put you over the edge in the same way that sometimes just being acutely ill can put you over the edge. A lot of older adults are functioning fine in the community, but when they become ill and hospitalized, they will become somewhat demented during their stay at the hospital. And then once you put them back in their own environment, once they are well again, then they go back to their previous level of function. But it's always worth, if somebody in your family has a little bit of cognitive impairment, to ask, are they taking a new drug? Is there something that maybe they could switch to? What does not work? There is no data that any of these brain training products, any of these apps, actually enhance cognitive ability in the real world. You will get better at doing their little exercises, but there is no data that translates to being better in the rest of the world. And Lumo Labs, which claimed that their Lumosity app could prevent age-related memory decline, had to pay $2 million to settle a false advertising suit brought by the Federal Trade Commission. And I am sad to say, ginkgo biloba does not work. I tried that, and my kid, who was about, 7 or 8 at the time, he said, "What are you taking that pill for, Mom?" I said, "To make my memory better." And he looked at me disdainfully and he said, "It's not working, Mom." And sure enough, within a few months, what is considered the definitive study on ginkgo came out and showed that there was no improvement in cognitive function and no slowing of cognitive decline. There is data that what our brains are like when we're young predicts what they'll be like when we're old. Big study recently published. They've been following one group of people that they did sort of typical personality and spatial learning and vocabulary testing on when they were in high school 50 years ago. And they've been following them to see, what personality traits and things like that predicted, heart disease and early death and all those things. And they asked this cohort of people what they were interested in. They said, "We want to know about dementia." And so they have teased out the data and have found that people who as teenagers had better spatial skills and better memory for words and had less dementia 50 years later. There's a very famous study that was done on nuns. They looked at elderly nuns and went back to their intake essay, when they became sisters at 21, they all had to write an essay about what it meant to them, why they were choosing this path, and the complexity of their sentence structure and their vocabulary at 21 was a strong predictor of whether they would have dementia in their 70s and 80s. So, my plug for early childhood education, there really is no data that if we teach kids and improve their vocabulary and improve their reasoning and improve their spatial skills in elementary school, junior high, high school, that we'll stave off dementia. But I personally think we should be doing that anyway. And so this is one more argument for doing that. Now, is it the people who just naturally are lacking in those skills that just have less brain reserve and develop dementia? Or is it the people who just didn't have the same educational advantages, didn't go to good public schools, didn't have parents who read to them? Are those people more at risk? Is it something inherent in their brain, or is it more an environmental issue, and I would argue that there's probably both to that. And we can't change their genetics, we can change their environment. We can improve their ability to learn, to have good vocabulary, to be exposed to books, to be exposed to math and science, to all of those things. So that's my plug. Would it make a difference? It would take 60 years to know. Research, where we're going in the future. There have been, we know that brains that have dementia have more amyloid. That's this sort of sticky substance that accumulates in the brain of people with dementia. In fact, a third of the population will have significant amyloid in their brain. And so there's been a push to try and create drugs that will dissolve this amyloid to see if that will treat mild cognitive impairment and see if it will treat dementia. And there was one big trial with a new drug. I won't even try to pronounce it. It was an Eli Lilly drug. They were looking at pre-symptomatic people who had no evidence of cognitive impairment, but on these imaging studies had significant accumulation of amyloid in their brain. So these were people who were at increased risk for dementia. And they did a randomized controlled trial. Half the group got this new drug, half did not, and they followed them, and there was no difference, none whatsoever. So there was a difference in imaging. On the imaging, the amount of amyloid in their brains dramatically decreased. But the important part is that their cognitive function was not improved, even though the amyloid, which is a marker for dementia and risk of dementia, was substantially reduced. There are 2 other drugs that are in testing. And again, they reduce the amyloid, but the cognitive effects seem to be modest at best. There's some research on giving a larger section of the population diabetes drugs as prevention. So starting people on diabetes drugs when they're even just barely borderline diabetic rather than waiting for them to become overtly diabetic to see if this will impact their long-term risk of dementia. This is actually a really interesting study. This is Dr. Jocelyn Bloch. She's a Swiss neurosurgeon, and she has been able to isolate and grow brain stem cells and has used them to reverse stroke damage in primates. So she created a stroke in the brains of these monkeys, and then she gave them time to have stroke recovery. And just like humans, primates will regain much of their function. So if they lose the ability of one side of their body to move, they'll regain a lot of that function over the ensuing months. And in fact, they regained about 50% of the function that they lost, which is about what is typically happens for people who have a large stroke as well. Then what she did was she implanted these brain cells in the area of damage. And even though it had been many months since the stroke, these monkeys regained almost 100% of their lost function, months after their strokes. And if you put those cells in a normal brain, they just disappear because the normal brain says we don't need them. But if you put them in a damaged brain, there was dramatic recovery. And so she is trying to get, consent to, through medical review boards to test this in humans. And if this turns out to be the case, this is going to be dramatic for people who've had debilitating strokes. I've spent most of my talk talking about dementia, but really for stroke patients, this is amazing research. So this is my final slide, that, you can try to retrain your brain, but like I said, learning something new, learning something difficult, learning a new language, all of that is good. Our focus should be to sustain our brains, and we do that with exercise, with better diet, with reducing our risk factors for diabetes and for heart disease, and trying to maintain our good brain for as long as possible. We can't change that we're getting older, but as my husband says, we can stave off the decay as long as possible.